Hey there, today I'm diving into everything you need to know about discectomy surgery. Whether you're preparing for the procedure or just curious, this video will give you all the essential details. So, what exactly is a discectomy? Simply put, a discectomy is a surgical procedure to remove part or all of a herniated disc in your spine. This herniation can press on spinal nerves, causing pain, numbness, or weakness. By removing the problematic disc material, the surgery aims to relieve these symptoms. Now, who might need this procedure? If you have a herniated disc that hasn't responded to non-surgical treatments like physical therapy, medications, or injections, your doctor might suggest a discectomy. It's typically recommended for those experiencing significant pain, nerve-related issues, or difficulty with daily activities. Let's walk through the step-by-step process of a discectomy. First, you'll be put under general anesthesia, so you'll be asleep during the surgery. The surgeon will make a small incision over the affected area of your spine. Using special instruments, they'll carefully remove the herniated portion of the disc. Sometimes they might also remove a small part of the bone over the nerve to give it more space. The incision is then closed up with stitches or staples. The whole procedure usually takes about 1 to 2 hours. Now, let's talk recovery. Recovery from a discectomy can vary from person to person, but here are some tips for a smooth healing journey. First, follow your doctor's post-operative instructions closely. This might include taking prescribed medications, avoiding heavy lifting, and gradually increasing your activity level. Physical therapy can also be incredibly beneficial in aiding your recovery and strengthening your back. Remember, it's important to listen to your body and not rush the healing process. Lastly, what are the potential risks and outcomes? Like any surgery, a discectomy comes with some risks. These can include infection, bleeding, nerve damage, or a recurrence of the herniated disc. However, most patients experience significant pain relief and improved mobility following the procedure. Discussing these risks with your surgeon beforehand can help you make an informed decision. So that's a wrap on discectomy surgery. I hope this video has provided you with a clear understanding of what to expect before, during, and after the procedure. If you have any more questions, be sure to reach out to your healthcare provider. Thanks for watching and take care.